without any names that we had to do. And whenever they used to come to our hostel, we used to switch off the light and then they used to tell whatever we want to tell. So all such feedbacks we used to give. So I made it a point that I seek feedback rather than after becoming a teacher. Even till today, wherever I work, I select few students, very good, mediocre, and I ask for a feedback, telling that it will not be affect anyway for my improvement. I always keep on collecting any new method I apply. I would like to collect the feedback. Not in a formally like this in a paper. I would like to ask whether it is good, bad, but all different stat of students I would like to ask. That I have been doing, I will continue to do it. But not like this in a formal paper and other things.
Though we say it is all these principles should be followed, it is very difficult to follow. In a time, if you take time, who has patience? Who has time that much? But at least in that, somewhere we take out a time. Because as a teacher, our role is mentorship, all yesterday we discussed so many. Our role is as a facilitator. All that, at least some extent, if not every student, wherever we observe something, do a little bit of every day, time for them, I think we can do justice to our job. Anybody would like to say anything? Then why is feedback important? It facilitates change, definitely, when we are receiving. It improves the performance, reinforces the positive behaviors, and corrects the undesirable behaviors. Definitely. It will definitely help if it is given in a correct way. It will help with all this. It is very much valued by the students. We must realize here that students will be waiting for one word of encouragement from us. If you have observed in a class, suppose whenever whoever answers, you say very good, or you take their name as she said or he said, next time they will be waiting to answer. If you have observed, they will be waiting to answer. Sir will ask, madam, you remember my name, and they will ask again. You know, so that encouragement is always there, and that makes them feel it is very much valued. Oh, sir is concerned about me, then I should improve. That means they have an expectation in me. They are observing me. I should improve. That will be there from the students. It's very much valued by the students. And it decreases the learner anxiety. When we give them in a proper way, it decreases the anxiety, definitely. Improves self-assessment for students. Okay. Then now coming to feedback versus evaluation. Is the feedback same as evaluation? I have already put versus over there. It can't be same. So if they are different, in what way they are Yes, ma'am, rightly. As madam says rightly, it is feedback is one thing immediately we are giving and it is very specific. Whereas evaluation, you are giving global performance. You are giving your opinion about the global performance, but that also intended along with the improvement of the performance, that is for the global rating. For feedback, you are not rating me. Suppose if you give me immediately after my session, if you tell, you are just helping me for improvement of my own presentation, but you are not giving me a group, some rating, that you stand 5 or 10, 4 or whatever. But for the evaluation at the end of 3 days, which you will be filling up all this, the 3 days, that is an evaluation. Formative, we have a scope for feedback, exact, something like that, something. Exactly, but assessment is again different from evaluation. Let us not confuse again. Suppose if you say people get confused, something like that. So feedback is definitely not evaluation. Then what are the difference? Feedback is given timely and it is in an informal setting. In an informal setting, maybe we call that formal, but it is given orally. You can call separately and given. It is in the informal setting and it is based on the observation. Content is very objective and specific. Scope is it is intended for specific action and for the improvement. Whereas evaluation is scheduled. We have at the end of 3 days, we give you evaluate today we give you that is scheduled for 3 days performance. That is for the overall following, for the workshop. Then it is very formal. In the sense we give it in a written format, something formal. There's a formal, filling up and all that. It's very formal. That is also based on objective, observation and objective. This is intended for the global performance along with grading and improvement. Also for a grading and improvement. There is a slight difference. Now, since first day one we are seeing we set the objectives, then we plan the teaching learning activities, then we plan the summative assessment. So the student comes to us, we have all these activities. Where is the scope of feedback of all this? Is it here? Is it here? Is it here? Day-to-day learning activities. The scope of feedback is in the day-to-day learning activities. That is formative. As morning sir was saying that after every session you can give, or after formative assessment you can give feedback. So you observe it and you can give a feedback. The barriers to give good feedback. What are the barriers? We all know now that we give, but still we may not be able to. We have not been able to give so far. What are the barriers? Okay. One is, why state the obvious? Many a times we think that as if it is not told to them, they have been taught in a orientation program. In my first class itself I have told them how to behave with the teacher, student, their patients. I have told everything as if they don't know. Why should I tell them? Let them learn. That is also there. Sometimes some of the teachers have this attitude. Why should I say it? As if they don't know. We don't give. We avoid. Then this is awkward. How to tell this? As I said, one of the situation, female student, female PGs, or they are like in service, how to tell them as if it's quite awkward. Forget about it, we will not do. We avoid the situation. So we avoid that. Then what's the use? Don't we say that? Yes, whatever you say, they are like that. We have most of the time we have this attitude. Sir? And the students, we have the students, yes, they will not improve. We have that most of them, when we discuss in the department, I come up with this point. This is what I have added actually apart from the literature. When we just discuss in the department, whatever it is, how much to tell them, yeah, they are like that only, don't tell finish class after that. They'll be talking, and how much is all batch, no? I wanted to just go tell orally why you want for them. You have that this thing, but we don't realize how important it is for them. For us, there are 100 students. But that one student, it is 100% of that one student. We don't realize that. Then the next, I think, most important, again, the most common, most important is who has time. We have been into so many activities. I am into this committee, I am into that committee, and now we being into university, we hear this, I am into university, that committee, NAT committee, UGC, this inspection, and we have 15 courses apart from MBBS, let me tell you, this is apart from the topic I'm presenting, 15 courses, each one of us in charge of that bag. BSc nursing, physiotherapy, dental, nursing, all the other BSc, MLTC, BSc allied courses, where the basic sciences are must for them, and where all the basic science departments are involved. Their evaluation, who has time for all this? Who has time? I don't have time. But we have to remember that somewhere here, as a role of a teacher is to facilitate. So we have to remember, as one of the roles of the teacher, we are teachers by choice, by chance. We have to do a bit our bit for it. Then it will be possible. What is this? Still not hungry, no? Still time is there, it's just Charlie. Not hungry, no? I think I will put this sandwich, no? Not a time for breakfast at least, breakfast everybody has time. Not for break, not for lunch, sir. Lunch will have. Okay. That's it. Now I realized all these days no one gave me this response, so I never realized student is in between sandwich between. True, sir. True. Student is sandwich, so we don't want the student to be sandwich. So we'll adopt a sandwich technique to give feedback to the students. It's the name of the technique that we use. There are different techniques, but the most adopted and which has been very effective worldwide is feedback sandwich technique. Why do they use this feedback sandwich? Why sandwich only? Why sandwich technique? What do we mean by what do we mean by sandwich technique? Mixture could have been, I think, patties or what do you say?
component at the center and two similar things.
Exactly, so what are those two similar things? Exactly, so we'll just go through that. Two positive, like our constructive criticism is given in between the two positive notes. So that is called as a feedback. So start with what did you do well? There is a positive feedback. That is one layer. Obviously. Then what could you have done better? Yes, constructive criticism here, positive criticism. Then how could you have done it better? What needs to be changed? Like I said example, your slides needs to be changed, ma'am. Your slides can be improved. But how can it be improved? Slides need to be changed means what should I change? Is the background, the color, the design, the linings? What do I need to change? So if you tell me, ma'am, there are too overcrowded, you could have reduced the size or what number, you could have increased the font, you could have used this font particularly, you could use this color background, then that is a how could I have? That is a constructive advice. That means here there is a plan of action, there is a suggestion for a plan of action. What can I do to do myself better, to improve myself? And end with a positive note. To make sure that you are made clear and check the understanding and end with a note of positive or encouragement. I'm sure you will do well. Like in the second scenario you said, there's nothing big deal, you have been doing so well, that's not a problem at all, you will definitely do well, I'm sure you will do well. That gives a, again, positive note. So, give a constructive criticism, it will lead to positive note. Start with a positive note, give a constructive feedback and then end with a positive note. That is feedback sandwich. So take home message is, feedback can have a very powerful effect on learning. For feedback to occur in the setting of medical education, performance must be observed. The focus of feedback influences its effectiveness. Definitely, if you are focused, it will be more effective. Feedback is not evaluation. Let us remember this and thank you.
Now I will be teaching on a very important question what we will be doing almost in a regular way. It is called as an essay question. Okay? So how to do an essay question? How to construct an essay question? What are the important advantages and disadvantages of framing an essay question? I think all those details I will be doing now. So as you all know, essay questions are the most commonly employed methods for assessment of cognitive skills. Agreed? It's one of the most important tools to examine the cognitive skills. Indeed, the complex cognitive skills like analysis, synthesis and evaluation can also be assessed, provided if we use correct words and phrases to construct the essay questions. It also allows assessing students the ability to express, ability to organize thoughts and communicating in writing. Okay, so these are some of the very, very important features of this essay question. What is so unique about it? The definition is itself almost is like an essay question. Okay, the Stalnaker was the first person as an educationalist to define the analysis. It's a test item which requires a response composed by the examinee, usually in the form of one or more sentences of a nature that no single response or pattern of responses can be listed as correct, and the accuracy and the quality of which can be judged subjectively only by a skilled or informed in the subject. Indirectly tells the one who evaluates this essay question should have a thorough knowledge about the objectives, okay, the specific learning objectives. What are the important advantages of having this essay questions? Essay questions advantages.
The idea the students know can be interpreted in an organized way.
I am asking about advantages.
evaluate the students. Evaluate the student.
Advantages of the same.
Give all his views about the platform which is asking.
Okay, he can always almost write everything he knows except what is asked.
What is broad topic is written, and even if he doesn't know small, minute things, it's not at that level, so he can construct a beautiful answer so that the different heading. So it gives the overall idea of the subject. Unlike a MCQ or a short answer where you need to know individually, specifically. Even if it forgets 2 points, it's okay.
Any inputs from you? Advantages of
The student knows little, he or she can elaborate more, filling up the pages. Sometimes the evaluators, if they are not very particular, students can score better with that.
there is a chance of bias.
Same thing I wanted to ask Madam. It will be sometimes beneficial for evaluator. Just see the lines and award the marks.
Advantages are it's an open-ended question. Considerable flexibility regarding the scope and content of the answer. You can evaluate student thinking, reasoning skills in most cases, and these skills require the ability to construct a solution for the decision rather than select a solution or decision for the limited set of possibilities. Assess higher order or critical thinking. Sometimes we can also elaborate from the student the higher cognitive mindset. It's unique and yes, one most easiest thing. It's very easy to frame. It's very easy to frame a essay question. That's it. What are the limitations?
Jason, can I interfere for a minute? I just remembered on question paper in Pune University, previously not now, for MD pharmacology examination, the third paper constitutes only one question for 100 marks. There was one question, of course I was heard by some examiner, that write the things you know about morphine was the question. The answer was I do not know anything about morphine. And I heard that it went to the court. And the court decided in favor of student. I don't know, I am not the witness, but I heard about it.
Limitations of the question set is open-ended, often written in nondescript phase. It gives no idea to the student as to the scope of the answer. Assess a limited sample of the range of the content. Sometimes it's difficult and time-consuming. Your variability. This is one very, very famous question and answer which has been there since long ago. Once there was a question which was asked for 15 marks. The student answers like this. How to kill an ant? Was the main question. So he go on answer like this. Mix chili powder with sugar and keep it outside the ant soap. After eating, ant will search for some water and it will go to near the water type. Push ant into it. Now ant will go to dry itself near the fire. Next slide please. Next slide. When it reaches fire, put a bomb into the fire. Then admit the ant, wounded ant into the ICU. Remove the oxygen mask from its mouth and thereby we can kill an ant. What is the purpose? Okay. So this sort of things happen when we write in an essay question. So moral is, don't play with students. They can do anything for 15 marks.
Students say I can kill an ant for 100 marks also.
Connectivity, low validity and reliability. That's what I was teaching in the morning session. Yes, scope of guesswork. Somebody was telling bluff, they can bluff. The first answer and its assessment influence the subsequent ones. Okay, that is the most important one. That's what sir was elaborating it. And the students with marginal writing skills are at serious disadvantage. That's one of the most important limitations which we have to think whenever you frame an essay question. Two types of essay questions are commonly there. One is the traditional essay question, what sir was describing. Describe diabetes mellitus. What to describe? Nobody knows. Traditional essay question. The second one is the structured essay question. These are the two types of essay questions commonly formulated. Write an essay on OPD analytics. Second one, diabetes mellitus. These are some of the examples of the traditional essay questions. Next one. How to overcome this? Next one. Structured essay question. So what do you mean by this structured essay question? It's restricted response question. So I have formulated the previous opioid analysis question as classify opioid analysis. Right there, mechanism of action, pharmacological actions, and its uses. So I was very precise, I was very specific in framing the question, so that there will be no confusion among the students.
This question is okay for undergrad students, but the previous question could be okay for postgrad students. They are supposed to know everything.
But the problem is comes into the valuation. So next slide. So limits the scope of the content, directs the student to a precise and specific response, improves the reliability, marking by the checklist improves the objectivity. So please prepare a checklist what exactly you want in the evaluation. That's what I was telling you. What are your SLOs, specific learning objectives? Prepare that one. So if it is there, you are going to answer. Evaluate it. Otherwise, there is no points. Test the student's problem solving the ability. Next slide. How should essay questions be constructed? To match the question to the specific learning outcome, define the task clearly, break the topic into precise division, giving the problem-based orientation as far as possible. Phrase the question in a simple and a clear language so that the student will be easily know what exactly the examiner wants. There should not be any ambiguity. That's what I mean. Next one. Terminologies that are explicit should be used. Example, list, define, compare, etc. Use carefully the terminologies like discuss, describe, write all what you know about, etc. That's what someone was asking. No, sometimes we can use that one, but use it very, very carefully. Avoid any optional questions, no ambiguity. Provide ample time for answering and suggest a time limit for each question. That's the most important one. And indicate the weightage. Indicate the weightage to different parts of the question. This helps the student to effectively plan his also and also time management. So something like this. I think this can be one of the ideal questions. Classify opioid analysis. Write their mechanism of action, pharmacological actions and uses. Okay, with the marks. Next question. Next question. Now what do you have to do after preparing that one? Prepare a model answer. List all the required components of the answer. Match the directions given to the examinee. Reviewed by the content expert for accuracy and completeness. And there should be more standardization and objectivity, especially framing this structured essay questions. Next. So, whenever you frame any question or whenever you talk anything about the knowledge of medical science, please remember these three important cognitive levels. One is the knowledge. Okay, so when you frame a question, there should be some component in that question which tells these things. One is the memorize and recall information of the student. The comprehension. Can he be interpreted after writing that question? Application. Can he apply the knowledge to a new situation? Okay, you have to frame in these orders. Keep in mind. Next. Analysis. Break down the knowledge into parts and show relationship among the parts. And the synthesis, bring together parts of the knowledge to form the whole, build relationship for the new situation. I think this has all been taught by Dr. Chandrasekhar Karpur on the day one. This I am revising it. Evaluation, yes. The students make the judgments on the basis of the criteria. Yes. Yes. In framing this question, see some of the important words you have to use to test certain domains. Number one, if you want to test the knowledge part of it, use these words. Define, label, list, name, repeat, order, arrange, memorize, etc. to test the knowledge component of it. If you want to test the comprehension part, use these words: describe, indicate, restate, explain, review, summarize, classify, etc. And the application part: apply, illustrate, prepare, solve, use, sketch, practice, calculate, etc. So these are some of the important things, some of the important words you have to use in framing the questions while testing these important higher cognitive levels, that is knowledge, comprehension, application. Next slide. Yes, in the analysis part, these are some of the important words: analysis, synthesis, and evaluation. Next slide. Now, essay questions have the potential to reveal student abilities to reason, create, analyze, synthesize, and evaluate. I think you all said on the first slide itself all these things. Next one. What do you mean by this short essay questions? Short essay questions are nothing but these are more structured questions. Need relatively less time to answer. They are more specific. Okay. Carefully select the appropriate tasks. They are more objective. Wide range of topic can be covered. Example is write the clinical features and treatment plan for permanent tuberculosis. This type may be asked for the short essay questions. Next slide. Yes, one of the you can tell it is a disadvantage also. Test the lower domains of learning. The short essay questions sometimes. Test recall of knowledge only most of the time. Student may be required to write a word, phrase, sentence to complete the statement. And longer the expected answer, more is the subjectivity involved. Types of short essay question has been classified into three based upon the experience, that's all. One is completion type, you have to, it's something like you are filling the blanks there. The second one is the definition, define method mortality rate, define something like Bloom's taxonomy, something like that. Numerical one, to prepare 1 liter of home-based oral reagent instruments, the following are needed. So how much is required? That is a numerical part. That you can write it as the short answer questions. The advantages, yes, it is easy to construct comparative to the MCQs. Okay, it's very difficult to construct an MCQ, so it is better to construct a short essay or short answer question other than the MCQs. It's more specific than essays and it is more reliable. Of course, it's quicker to answer and less prone to guessing than MCQs. I think that's what Chirag sir was saying. There may be guessing in the morning. The short answer question, the less prone to guessing than MCQs. And yes, there is increase in objectivity. Those are some of the important advantages of these short answer questions. Next slide. Disadvantages: test only the factual knowledge and not its application. Students will be very lucky if what he has studied comes as a short notes. Okay. If he has not studied and if it has come as a short answer question, I think then he has gone. So don't cover much syllabus as the MCQs. In the MCQs frame, you can cover more syllabus and you can also attend more number of students in case of the MCQs. Next slide, please. Next is the problem solving question. What do you mean by this problem solving question? One problem is given to you. Okay, based upon that, you have to calculate or you have to evaluate the question. Okay, so short history is based upon which the question is solved. Student is to apply what he has learned in the question in the context of situation. A 1-year-old child is brought to the casualty with diarrhea for 1 day. There is no vomiting. On examination, he weighed 9 kg and had evidence of moderate dehydration. You decide to provide oral rehydration. Next one. Now comes the group activity. So this is for group 1. This is for group 1. This is for group activity. So you have to modify that one. It is a question. 2 exceptions are there, 2 short answers are there. Okay. And modify it and how better that would have been expected. write in detail about edema. Write an assignment on saline cataract. Immunology. Groups, please listen.
Family planning. Describe the advantages and disadvantages of each. Quick messages.
One second.
List the methods of family planning. Describe the advantages and disadvantages of each.
Please listen. I have a comment on
Whether in male or female.
Actually, the last part is each method is. So I think you should be told which proper method, whether it is direct contraceptive or whether it is permanent method.
It's a question they need to know and they need to write. Because family planning is very important.
Depend on diabetes mellitus. Define diabetes mellitus, its classification, clinical feature, and management of diabetic ketoacidosis. 2 plus 2 plus 3 plus 3. Short answer question. It's for name the nucleotides of DNA. Right atrium. Name the blood vessels entering the right atrium.
Essay question. Define thyrotoxicosis. Describe the etiopathogenesis, clinical features and management. Marks distribution is 2 plus 3 plus 2 plus 3. Second one, classify metabolic disorders, describe clinical features, complications and drug interactions in G6PD deficiency. Marks 3 plus 2 plus 2 plus 3. Short answers, write any 3 methods of classifying protein energy malnutrition. 3 methods of classifying malnutrition, and second one is write the clinical features of Turner syndrome.
Classical metabolic disorder is very huge. You can just tell. Metabolic disorders is a huge. So you can just tell what type of metabolic disorders. Classical metabolic disorder is a huge topic. Like which metabolic, like is it a compounded metabolic disorder, protein disorder, or
Define amyloid, please. Define amyloid. Describe the etiopathogenesis, clinical features of amyloidosis. Define amyloidosis and explain the etiopathogenesis and clinical features and treatment of amyloidosis.
It's okay, whatever they are included there,
What is the
Define amino acids 2 marks, secure pathogens 2 marks, chemical filter 3 marks, and treatment 3 marks. It's the hormones, molecular mechanism. It's the hormone affecting the human growth. Any one hormone affecting the human growth. Clinical features and management. Short answer. Or mention one.
So we'll see this police describe this, which shall we just give this to a particular department specialty? So police describe this, where shall we put it? Which department? Surgery, okay. Only as a surgery to answer the question.
Discuss clinical features and management of acute polycystic.
3 months question.
Mention important low clinical signs in acute polycystic.
So if I write to
So the long question discuss the pathogenesis, clinical features, diagnosis and management of SLE, 3 marks, 2 marks, 3 marks and 2 marks. Classify edema, discuss the pathogenesis of edema and elaborate its management, 10 marks, 3, 4, 3.
Assessment of which edema? Let us put edema in pathology. This edema question is for pathology department.
It is when it comes to the treatment, it should be more specific. Edema of which edema?
Question on edema. Classify edema. Classify edema. And discuss the etiopathogenesis and describe the pathology of edema.
Which one? Because the general particular. So if a medicine person wants to take this question from my friend, edema is your question, how is that?
Classify edemas, define what is edema, classify and put a note on pulmonary edema. Pulmonary edema, treatment.
What is the examiner expect?
Note on the. So what is the different mechanisms involved in the formation of edema? Maybe a cytotoxic, maybe a bacterial, or just we expect. Usually, there is there in the second year, different pathogenic edema. Treatment, we are expecting more of a treatment part rather than the pathological. We want straight to know what is the, how should they treat when it comes to somebody's diagnosed, and they should know how to minimum things. Yeah, fine.
Dr. Balraj, sorry to interfere. I want to add one point here. That whenever we write the question note on, it will be a part after finishing 75 to 80% of the main question. So for example, I describe, classify metals on things, describe the pharmacological action and uses of say aminophyllin, add a note on management of status systematicus. Yeah, it should be added. Note should be not more than 20 to 25% of the portion.
And management includes investigations also. Investigation and treatment. That's why you have to classify whether management or treatment.
And as much as we discussed, add a note should be avoided. But add a note can be anything. It can be 3 lines access and 20% for somebody, it may be more. As such, there are another 2 components. So be specific, right? Or list the investigations. With justification, you can also ask, justify why you need to do this. Or add in the right order, management. Explain the management, whatever. Better avoid those ambiguous terms like no. That's what sir.
Next, no, we are not finished. This is the real spirit.
For short answer questions, AIDS, we can ask either modes of transmission of AIDS or at least salient clinical features of AIDS.
Most about I would like to ask, define AIDS.
Short answer.
The 3 more important modes of transmission. Enumerate 3 important modes of transmission.
Next, suppose if a first MBBS student is to be asked on cardiac output, I would like to ask the factors affecting cardiac output. Mention the factors affecting cardiac output. For 3 months. 6 factors affecting cardiac output. 3 months.
Yeah. But just let us have this. Anything else that has to be modified in this? You have modified already. Anything else? Practically, we have seen something else. Can you please don't write as far as possible abbreviations. See, IUD, IUCD. There was a short question which appeared for forensic people. It was AID. The students thought there was a mistake. They added S to it. They wrote about AIDS. How will the student know? No, let us not use it. Avoid this. Abbreviations. So that was, I think, artificial insemination donor, AID. So they didn't know, added S and then wrote about AIDS. Let us prevent this.
At the same time, some abbreviations can use like, for example, MTP Act.
MTP Act, yes. Standard ones, but when they're confusing letters, avoid as far as possible. Yes. So RS cell. I need to write it as Reed-Sternberg cell.
That's why we have to. Confusing abbreviation should not be.
Basic question, first one. Define and classify cataract. Describe surgical treatment and complications of senile cataract surgery. Define and classify cataract 2 plus 2. Describe surgical treatment and complications of senile cataract surgery 3 plus 3.
Ophthalmologist here. We call all these as modified essay questions now, MEQs, no? They're not main questions, they're MEQs now. MEQ.
Surgical operation can be a specific one. Mention about surgical operation for senile cataract. Procedure.
Different surgical methods.
And if we should not expect the regular student to explain the surgery in detail. So they can write the types of surgeries and complications. But we have divided the marks.
Define and classify cataract. Describe surgical treatment and complications of senile cataract surgery.
extracapsular, echo or conventional available. Then complications of each.
Because I am a non-optal person, for me I took it that way. For me, I understood that because I have to write all the certificate. That is what. If you are asking surgical treatment, is it the right question to ask surgical treatment? That's why. Mention the procedures is okay. But since that could have been asked in a practical, I mean, of course, even here that is different because it is given that is different. But can we actually ask it as a case?
So for underage students, we are not supposed to ask them to write about the special cases. You can ask any exercise.
Then you can ask that, mention the modes of surgical treatment, the types of surgeries. That is actually very different. Because if you say surgical treatment, so I understood probably if I was a student, I would have written the level.
You can ask whether the surgery is done.
Second one, describe the anatomy of inguinal canal, classify inguinal hernia, and describe surgical management of inguinal hernia.
Because surgical management is a broad question, because whether it is direct hernia or indirect hernia, you have to mention whether it is direct or indirect. Uncomplicated. Yes, madam. Management of strangulated inguinal hernia.
A very good interaction. I think we are running out of time.
Write the mechanism of action and side effects of rifampicin. And 3 side effects of rifampicin.